Hello, welcome to another edition of AFRINITY Connect with me, Wilfred Adams. On this special edition, we'll be talking about the Health and Social Care Providers Network, HSCPN, meet and greet session, session 13. And this is taking place Saturday, 28th day of June 2025. Without wasting much of our time, I will be bringing in the administrator of this meet and greet session. Her name is Betha. Betha, it's good to have you on the program. Hello, how are you?
All right. So it's Bertha here, the administrator for Health and Social Care Providers Network. It's good to be here. Thank you very much for having me here. We're here to talk about meet and greet session 13. That's going to be at the Marriott Hotel in Bournemouth on the 28th of June.
Yes, thank you very much. It's an exciting time. I was there on the 12th edition at Newcastle. It was indeed very colorful and very, exciting. Can you tell us before we bring in, we have notable speakers already with us. Can you tell us more about this program, please?
All right. So basically, what we do is the Health and Social Care Providers Network. We host meet and greets. It's basically an event that brings together professionals, organizations, companies, individuals, whosoever who would want to be in the health and social care industry or in the health and social care sector. If you are into supported living, if you're into Ofsted, CQC, anything that has to do with the health and social care in the UK. So we host these events for networking purposes, learning purposes, but mostly networking, coming together, discussing of the issues that are trending in the industry, what business tips other companies can use to grow, to develop, to expand their organizations, to expand their businesses. So we usually host these 4 times a year. We had the 12th one that you said you attended. It was in March at Newcastle, and this time we're going to be in Bournemouth on the 28th of June. And hopefully we're going to have quite a number of people who are going to benefit from this event.
Thank you very much. This is a live session, so we join in from every part. Thank you very much. I could hear most of the things. I know at the end we had some technical glitches there, but for the meantime, let's bring in Mr. Kennedy. I know we've got Mr. Kennedy. Please, can you unmute and introduce yourself? I know you're one of the main keynote speaker for this event. Can you tell us who you are and what you'll be bringing aboard come 28th of next month at Bournemouth?
Hi, Wilfred. Thank you very much for inviting me to share perspectives this afternoon. My name is Kennedy Mwedziwendira, and I'm based here in the UK. I live in Milton Keynes, but I have been invited to speak at the Health and Social Care Providers Network in Bournemouth on the 28th of June, and I'm very excited to be part of the team that will be sharing ideas. I've just been listening to Betha, who said that this event is about networking, it's about learning. So what I'll also be bringing on the day is not just networking, but also a way we can help each other, a way we can remind each other on certain aspects of ensuring that our health and social care provision is something that actually is received well, and is something that also makes impact, especially to the people that we serve. So I'll be speaking about how, as providers of a service, we can exceed customer expectations. Why am I going to be talking about that? Is because every business, everything that we do in as far as provisioning of any service is concerned is focused primarily at a customer. One way or the other, there has to be a customer on the center. So in as far as ensuring that we deliver, we want to do it in a manner that is going to exceed customer expectations. So it's a very topical issue that we are going to be talking about. It's a very important subject, in the sense that we want to delight our customers. We want to go beyond, what they would be expecting on the day, or, not on the day, but as we provide, service, as we go on our day-to-day service provisioning. So yes, it's a pretty much, strategic, topic. It's a very important topic that ensures the survival of any business wherever you are. So I'm very excited to be part of the speakers team, and I look forward to meeting everyone on the 28th in Bournemouth.
Wow, thank you very much. That was very precise, and making whoever that is watching now want to meet you, also want to hear from you. Making customer the king, or the queen, is very special. So I'm really impressed. Thank you very much for that insight, and we look forward to 28th. Um, I will go straight now to one of the co-founder, one of the organizers of the main event, Mr. Wilson, is also joining us. Mr. Wilson, please, can you tell us, where you are, who you are, and what to expect, please?
Oh, well, my name is Will.
Okay, okay. I think we'll come back to him later. We'll go straight now to Dr. Matthew. Dr. Matthew, I think we're having problem with connecting Wilson. Please, Dr. Matthew, you're welcome. Please unmute yourself and tell us who you are and what you bring. I know the last session you were there and you spoke very well about insurance. So what are you bringing aboard in this 13th session?
Yes, Wilfred, can you hear me?
Loud and clear, can hear you.
Good, good. Good to see you, Wilfred, again. We have met before, and thank you so much for the invitation. My name is Dr. Matthew Undenge. I'm a director at Igumat Insurance Brokers here in Leicester, in the United Kingdom. But we have national reach. So I will be presenting on a topic entitled Transferring Business Risks Through Insurance, Enhancing Overall Business Resilience. That's the main topic that I'll be working on. So in a nutshell, business insurance plays, of course, a significant role in enhancing overall business resilience by transferring risks from a business to an insurance provider, thereby allowing businesses to better prepare for and also recover from unexpected events. So this is what I'll be talking about, and I'm really looking forward to meet like-minded speakers. We have had the lineup has been already been produced, and we're really looking forward to that to the presentation. And collaboration and networking, there is nothing that beats that. And I know HSPN, they are very, very good at doing that.
Thank you very much. Yes, and that's the whole essence of the program, and I'm happy you're putting that point very clear. And we're also excited to hear from you with your words of experience when it comes to business insurance. So everybody is also looking forward to seeing you. Thank you very much for that insight. Before we round up, for Mr. Kennedy, you have some more things to share for us. That's take home for anybody who want to look forward to seeing you on the day, to hear from you, also to network with you. Give us, I know you have other things you want to go do. Please share with us before you leave us. Thank you.
Thank you, Wilfred. The only word that I would like to leave with maybe yourselves and the audience that are going to be watching this is that it's going to be a very exciting day on the 28th. Come prepared to learn. Come prepared to also, pick a few pointers, a few golden nuggets here and there. We're going to be talking about, the ability to listen, not just to hear. We're going to be talking about, navigating in the area of the platinum world. We have not yet known this issue to saying the era we live in is actually now called a platinum era, not the golden era. So we are going to be talking about that in as far as, empowering each other towards exceeding customer expectations. So it's going to be exciting. It's going to be a lot of, fun, sharing with people, because I'll be bringing in quite a few quizzes as well. So come prepared, and let's also be looking forward to having good fun and also networking and also learning with each other. Thank you so much, and I look forward to meeting everybody.
Thank you very much. And I love the word platinum. That's higher than the gold. So let's go on a platinum level. Thank you very much, Mr. Kennedy. We look forward to seeing you, sir.
Thank you so much. Cheers.
Welcome. Thank you. I've got, yes, Mr. Wilson is still here. Mr. Wilson, we almost lost you, but you are here live and direct. Technology almost failed us. Please tell us what's happening. What's happening? It's 13th edition, meet and greet session.
Yes.
What's happening?
The meet and greet session is happening in Bournemouth. And then most people think that the program is designed for providers only. But no, this is for everyone who is in the health and social care sector. That means the COS, the carers, the nurses, the doctors, the directors, anyone who has got something to do in the healthcare. So this is your day. So what happens now is we will have a chance to meet up with providers, and then you'll have a chance also to meet up with suppliers, and then you get to network. Then networking simply means that you have to get someone and at least have 5 people that you can rely on whenever you've got a problem. Then you just dial those numbers. Because what actually happens is that you might have your friend, your relative, who is in the business already. And then when you ask for certain information, this information, you're not going to get it from them. And then in the end, you will think maybe they are stingy with information, but no. In the health and social care, others might have started in 2020, others started in 2024, but policies keep changing. The framework keeps changing. So this is your chance, and this is the reason why we have these meetings after every 3 months, so that we update everyone about the changes that are happening in the health sector.
Wow, thank you. That's very, very insightful. That's fun packed. On that note, I want to ask you again, please, before we go back to Dr. Matthew and of course Beth. I want to ask you, how do I get in? Somebody there say, "Oh, I want to," this is very robust. How do I take part? How admission process and what?
Yes, what's going to happen is that as I said, that's on the 28th. And if you want to get a ticket, you can get the tickets on our website, which is www.hspn.org. That's where you'll be able to purchase your ticket.
Okay, thank you very much. And yes, I was about to ask Beta now. Thank you so Beta. Please, can you come on? Yeah, I wanted to ask about the other speakers. Beta, please, as administrator, I want to ask. I know we've got a lot of speakers. Dr. Matthews among them. Tell us, what are we looking at? The numbers we're looking at this time. Who are the other speakers that people should look forward to watch?
Okay. We have a long lineup, but they're going to be speaking on different topics that are going to benefit everyone who is in the health and social care sector. So we have Rumbi Budawabaya. She's a solicitor. She's going to be speaking about the white paper. There was an update recently on COSs, how they're being affected, how the UK now wants to stop recruiting and it wants to stop recruiting from outside UK. So she's going to be explaining more about that and how people can navigate. Throughout the year and throughout the coming years. Then we also have Thomas. Unfortunately, he could not join us. I think something happened with his machine. So but he will be there also presenting. We have Muchada Bunzawabaya, who is going to be speaking on a topic that has to do with supported living. Then we also have Nyasha Banire. Nyasha Banire was there last time on the session 12. This time again, he will be presenting on a topic that has to do with supported living as well. Then we have Caroline. Caroline is also a solicitor. She's going to be talking about criminal litigation. The number goes on and on and on. I can't list them all.
Yeah, that's I can confirm to you. You're absolutely right. You're absolutely right that the number keeps going. Dr. Matthew, please tell us about the insurance as we, round up the session. Tell us about, the new
Yeah.
things that you're talking about. Like Mr. Wilson has said, it's something that is revolving. You need that constant policy change updates. Just as it happens, you're live, you're up to date for your business, and of course to your service users. So please tell us about updates you'll be sharing with us and the reason to come
Yeah.
watch you.
Yeah. Thank you so much, Wilfred. I think the rest I will definitely share on the day, but I think it is worth mentioning that the word health and social care providers network itself speaks volume. And as a business, we are very enthused because we work with health and social care businesses. That's our core focus. We are a specialist health and social care insurance broker. Um, and the market is always changing, especially in health and social care, from immigration, and we have got distinguished solicitors who will be on the day, and also from the insurance space. Things are always changing in terms of the coverage, policy terms and conditions. They are always changing, and we will be giving updates on the day as well. But on that day specifically, I'll be looking at it will be mainly how obviously we can transfer business risks through insurance, and also discuss about claims management in a nutshell. So, just to summarize, how we help health and social care businesses. As a business, we look after businesses that do supported living, children services, domiciliary care homes, etc. Insurance for CQC and offset registration, insurance for tender applications, new business renewals, and all that. And this event is one that is not to be missed. And like Wilson rightfully said, it's open to everybody. So we are really looking forward to seeing you all on the event.
Thank you very much. Definitely, we're looking forward to seeing you on the event. Those are powerful words from you, and also the policy changes you're also excited to share with everybody. Thank you very much for that insight. Now we've got Mr. Gwen Masaka now. Please unmute and give us that, that message you intend to share and tell us who you are, please.
Hello everyone. My apologies for joining in late. I was caught up in other things. Thank you for allowing me this opportunity and platform. My name, obviously, as you can see, is Gwyn Masaka. I am an educationist in terms of background. I'm an HR person as well, and I'm also into management in health and social care. I also operate as a consultant in building businesses in dome care, as well as a bit of supported living, tender writing, and so forth. But my passion really is training and making sure that we make our, should I call them, our colleagues, the ones we work with, to help us to have competitive advantage. So what I mean by that is that in this ever so changing setup where we find ourselves in as healthcare workers, as multidisciplinary teams, it is important that we retain our staff. And one of the most important key issues is that our staff are properly trained. And a lot of providers underestimate that because they feel that it's costly. And because it's an intangible, they don't see the correlated benefits right away. People always think of cutting corners, training their own staff the way they want, and then sending them in the field. So it's like just having boots on the ground without having sharpened their skills before they go. So in the end, a lot of providers, a lot of companies end up dealing with a lot of toxic issues, which they don't realize that these are actually compounded by the fact that they are not trained at all. These our staff and our colleagues whom we work with, and in the end, we end up running about like a headless chicken. So a lot of providers actually are surviving by just as being opportunists, that these are the opportunities that are there, and therefore I'm a nurse, I'm a professional, I'm a social worker, I'm a teacher, I'm a doctor, so I can run home care, or I can run supported living, or I can run this service or that. But actually, they don't have any proper training in human resources. They don't have any proper training in retaining staff. They actually don't realize that it's an art form and skill to train staff and to keep them and to make them have an identity, because most people don't realize that our employees or even ourselves, you don't need to produce a business card. You are the card. You are the business. You are the business card. As you walk around, as you talk, as you relate, as you work, you are that card, and you can actually make your company move forward or backwards. So to me, training is key in all that we do. Training, training, training. And you can never put a price on it, but unfortunately we do. So that's what I'm talking about. I hope it makes sense.
Definitely, it make a whole lot of sense. Yes, it makes sense, and I love the part where you say you don't even need to have a business card. You work yourself. You are the business card. That's powerful, and we look forward to hearing more from you. And I know you're a passionate speaker. You're a passionate, trainer, and I know you have a lot to share. For those of you that are watching this, please get your tickets, join, and you'll be very, very glad you did. Before moving forward, I've got Thomas. I'll call him for the last time. I know he's watching us. Please, can you open your video so that we can see you? You can tell us, give us more information. Yeah, I think
Right.
he's here. Friend. You're welcome.
Yes, can you hear me now?
Very loud and clear.
Sorry. When you are old, some of these IT things mess
Technology.
you up. So
You're
I've
highly
been
welcome. I'm so glad to have you.
Thank you, thank you. Yes. Hello, my name is Thomas Musau, founder and director of ACS UK. We deliver accredited training and consultancy services in health and social care. Without preempting anything for the meet and greet event in Bournemouth, I will be sharing my tried and tested tips on how to cut your business costs in a way that you may never have believed is possible. My over 20 years experience has taught me that most business owners are too busy looking for money that they completely forget things that can save them that money. Let's meet there and come prepared for a day to remember. That's it.
Yes. and that's powerful. Let's meet. Definitely, it's a day to remember. I know Dr. Matthew have been here to round up, and also Mr. Wilson. You want to give us your final statement as to round up? We'll start with you, Dr. Matthew, as to round up.
Yeah, just to say, we are really looking forward to seeing um, all the delegates, including also the presenters. Um, so, like I said before, it is a day that is not to be missed, and you will come and you always uh, go away with something. Each time I go there myself, obviously I do go and present, but I also learn quite a lot from all the various presenters. So if you have not yet, bought your tickets, please can you do so? Um, and not only do we just do business insurance ourselves, we also do risk management. We look after health and safety, business continuity planning, and to assist health and social care businesses. And we are very, very enthused, and we are looking forward. We are always counting the days, looking forward to the event. And thank you to the organizers of the event. It is an event that is well worth attending. Thank you, Wilfred.
Thank you very much, Dr. Matthew. And Mr. Wilson, just your final word to the people out there.
All I can say to the people is that Bournemouth, we have discovered that it is costly. And then we have decided to then start at 9 o'clock and finish at midnight. And it is the session where we have got almost about 13 powerful speakers on this day. And also, the other thing that people should know is that these sessions, we don't charge for the sessions. But all we are saying is, you are paying for the hotel meals, because the hotel, as soon as you arrive, you will get tea. Later on, they will serve you with lunch, and they will serve you with tea again. And after that, they are going to serve you with dinner. So this is the price that you pay. So they charge us per head. So this is the reason why we simply give you that minimal cost. And I think on this day, you are going to benefit a lot, because at this point, a lot of people are panicking about immigration rules. A lot of people are panicking about the new CQC framework. A lot of people are panicking about how to get registered on Ofsted. And a lot of people are asking, how do we get clients? And we are saying, come to Bournemouth on the 28th, and then these presenters are going to share with you the tips on how to get private clients as well. So I hope and trust that I will see you on the 28th, and you can buy your ticket now so that you don't get disappointed. Thank you very much.
Wow, wow. Thank you very much. That's very powerful, well put together. And Betha, as we round up, because this is awesome. Like Mr. Thomas has said, we don't want to preempt, we don't want to say too much, but let's round up and get the people start calling and the numbers to call and where to buy the tickets once again.
All right. Thank you, Wilfred. So basically, I just want to say that this is an event not to miss, because this time we're going to have a guest of honor. Our guest of honor is Councillor Leslie Deadman, the chairman of Bournemouth, Christchurch and Poole Council. She will be gracing our event, and she will be there uh, she'll be there to address us and be a part of our event. Those who want to take pictures with the chairman, she will be available. So yeah, it's something that you wouldn't want to miss.
Thank you very much. And the numbers, or the numbers, I think it's scrolling. Do you want to call the numbers? People want to call to buy the ticket right now. The website again as to round up.
All right. For the numbers, you can call Wilson's number, which is 0785 162 2037, or you can WhatsApp me on 07769 379 253. Then on our website, you can visit our website, which will be www.hscpn.org. www.hscpn.org. That's where you'll be able to get your tickets, and all the information about the event is listed on our website.
Thank you very much. Go to the website. Like Betha said, you'll get the information that you can use. As we round up, Mr. Gwyn, welcome back. Your final statement as we round up on this session, please.
My final statement is kaizeni, kaizeni. Keep on moving forward, and you can only do that when you share good practice all the time. So let's come and meet and share good practice.
Mm-hmm.
Thank you very much. And also, finally, as we round up, Mr. Thomas.
Me, I'm looking forward to meeting these great minds on that day and network with them and pick their brains. They look to be quite informed and exposed. I love great minds. Thank you.
Thank you very much, and thank you everybody that have joined us, and also thank you for those of you that have also been watching us. We want to thank you all. Please, the place to be, once again, they've said it all, and there's so much you can benefit joining this program. I want to thank you all, to you and everybody that will be watching this program. God bless you all. Bye bye, everybody.
Bye.
Thank you. Thank you.
You're in
Bye. Bye-bye.